Hi everyone, Dr. Fink here. Today we'll talk about how testosterone replacement therapy could lead to type 2 diabetes remission or improvement in glycemic control in diabetes patients. Quick disclaimer, there's not medical advice, this is entertainment only. So the relationship between testosterone levels and diabetes have been intensely studied these last decades. We know that testosterone actually helps with glycemic control in the way that it it activates GLUT4, which is a molecule that lets glucose, sugar, inside of the cell and takes it from the blood, which is basically helping us with clearing our blood from the excess glucose. So, a lot of type 2 diabetes patients are also hypogonadal, which means low in testosterone. And there might be a relationship between lower testosterone and how well we can manage glucose metabolism. And there are several studies that really showed some benefits of testosterone replacement therapy in type 2 diabetic patients, and there are some that didn't show benefits. So I will try to show you two major studies about the topic and see what those showed and compare the results to each other. All right. So let's start first with this study that did not show major improvements with testosterone replacement therapy in type 2 diabetic patients with hypogonadism. This study was conducted on about 5,000 patients in several clinical sites. So it just gathered data from different hospitals, and it included pre-diabetic and diabetic patients, and it looked at if there is a worsening of the condition in both situations or an improvement. They used testosterone gel, 1.62%, and they adapted the dosage to get between the range of 350 to 700 nanograms per deciliter. And the duration was 48 months. And they did not show any improvement of pre-diabetic or diabetic condition with testosterone replacement therapy. However, study 2 used testosterone undecanoate, which is a very long acting ester of injectable testosterone. The dosage was 1,000 milligrams every 12 weeks, which is a very commonly used dosage with this medication. And it was conducted at one clinical site, so at one hospital. So this dosage was standardized. After up to 11 years, 34% of the type 2 diabetes patient had remission of the disease. 34%, a third of the patients could achieve remission, which is amazing. 83% achieved an HbA1c of 6.5%, which is almost normal. Okay, so what is the big difference in this study that showed so many benefits of testosterone replacement therapy in type 2 diabetic patients versus this study that did not show any benefits of testosterone replacement therapy in diabetic patients? Well, first, this study was not standardized at the same clinical facility, meaning they puzzled together several data, and the dosage of testosterone gel could have led to very low average dosage levels of, for example, 350 nanograms per deciliter, but they would still count it as average since the cutoff is 350. So we don't know if a lot of the participants were at 350 or at 700 nanograms per deciliter, which makes a big difference because 350 is borderline hypogonadal, borderline low testosterone. So that might have been the case, and meaning that even though they were on testosterone replacement therapy, the dosage might not have been optimal to put it in a range that is sufficient to achieve major improvements in glucose metabolism. Okay, so this is my opinion on this study. On the other hand, this study was standardized at the same medical facility, I believe, and standardized with the same dosage of testosterone and decanate of 1,000 milligrams every 12 weeks. Therefore, I believe that a standardized dosage administration of testosterone is a better way to show the effects of testosterone in this population of type 2 diabetic patients, especially 1,000 milligrams being a pretty standard dosage used for testosterone replacement therapy for this particular medication. So I would believe that this study is more relevant for the purpose of understanding how testosterone replacement therapy affects glucose control in type 2 diabetic patients. And if your glucose control, if you have high HbA1c or fasting glucose, for example, then you might check your testosterone levels to see if your low testosterone, if your testosterone levels are low, and maybe this impacts your glycemic or your glucose control. Okay, sometimes physicians just check your HbA1c, your fasting glucose, etc., and they want to put you on metformin or on insulin before even checking your testosterone levels. Sometimes the underlying cause of the impaired glucose metabolism lies in testosterone. Okay, so keep that in mind. If you have impaired glucose metabolism, so high fasting blood sugar or high HbA1c, always make sure to check your testosterone levels. Maybe that is the cause of your problem. And if this is the cause, testosterone replacement therapy can basically treat this condition from the inside naturally instead of having to inject insulin or taking metformin. Okay? I hope this video was helpful, and please let me know what you think down below. Thank you for watching.